If you've ever heard of lipedema, or maybe you have lipedema or know someone who does, please write in the comments. I want to hear your stories. You know, lipedema is something that we don't always talk about, but we really should. Guys, I'm Dr. Jen. It's good to see you. Now, lipedema, it's a condition where extra fat builds up, usually in the legs, but sometimes in the arms, and it primarily affects women. Now, the thing about lipedema, though, is it also causes pain. This excess fat causes pain, and as a result, there tends to be a lot of emotional distress. Now, I'm going to tell you more about what lipedema is, but I need to tell you what it is not, because oftentimes it can get confused with other things. And something I think is really interesting here is that lipedema was first described by Allen and Hines in 1940. If you ask me, that's not that long ago, and I really think that we're still learning a lot. Lipedema is not edema, it's not lymphedema, and it's not obesity. So let me explain. Let's start with lymphedema, even though I mentioned that second. Lipedema is an abnormal accumulation of fat, usually in the legs, sometimes in the arms. Well, lymphedema deals with the lymphatic system. That is different. It's an abnormal accumulation of interstitial fluid and adipose, fibroadipose tissues due to problems with your lymphatic system. Now, it is possible that somebody with lipedema has lymphedema as well, but they're not the same. Now let's move on to just plain old edema, okay? Lipedema, if you think it was like edema is in the word lipedema, but they're not the same. Again, lipedema, there's extra fat. Edema, however, is when we have swelling, which is related to fluid buildup. Now, many of you, I probably have experienced this. And by the way, I have videos on lymphedema, edema, and of course, obesity. I'll make sure I link them here throughout the video. If you don't see them, like if you're watching on Facebook, please just comment below and I'll add them. Now, obesity is different than lipedema because obesity, when you're obese, you tend to get fat everywhere, not just in the legs or possibly the arms, as I mentioned. When it comes to why some people get lipedema and other people do not, we don't know the exact cause, but there may be genetic issues, it may run in family, and then of course we do know that women primarily get this condition. So now let's go back to lipedema and just sort of drill down a little bit more with the symptoms. And again, if you have not written in the comments about your experiences with lipedema, please write in the comments. Also, I'm going to mention some treatments that we do have at this point that might be helpful for you. Lipedema can and often starts around puberty, but it can start in adulthood as well. And again, there is increased fat, like abnormally increased fat, usually in the legs, and the legs really look out of proportion to the rest of the body. And the fat buildup can really affect the hips down to the ankles. What's really important to note here, though, is that the fat that people have in lipedema is symmetrical, which means it's going to be both legs. See, with lymphedema, it can be just one leg. Edema, it can be one leg, okay? But with lipedema, it's usually both sides, all right? What's interesting, though, is that with lipedema, the fat may be often in the legs, as I mentioned, but it's not going to be in the feet. Likely, if somebody has lipedema in their arms, where they have fat in their arms, which is less common, but it happens, they're not going to have it in their hands. So the hands and the feet are spared. Now, along with this extra fat, let's focus on the legs, there's going to be pain. Pain when the person is at rest, when they're not doing anything. Pain when someone touches the legs. It can be really distressing, honestly. And speaking of distressing, let's talk about this emotional distress. I mean, oftentimes there's anxiety, there's feelings of sadness, feelings of feeling overwhelmed, because it can be really, really tough, not only physically and appearance-wise, but also how the person feels, okay? Interestingly enough, too, sometimes people with lipedema bruise more easily. So that's something to keep in mind. Now, I know you're wondering, okay, well, how is this diagnosed, okay? Testing is a little bit like, A lot of times, doctors can figure out if somebody has lipedema by asking questions about symptoms, doing an exam, etc. Sometimes doctors will do tests, but that may not be the main thing, okay? Just know that there's not, say, one lab or one imaging test that you can do or take that's gonna be like, aha, this person has lipedema, done, case closed, okay? They're gonna use a lot of different modalities to try to figure this out, physical exam, questioning, and maybe some imaging. Now let's talk about treatment. First of all, I would say that anybody suffering with lipedema, just like anyone suffering with lymphedema and so many other conditions, addressing your mental health is going to be important because, I mean, you can see why it would be tough, right? So that's the first thing, addressing mental health. Well, maybe it's not the first thing, but it's just as important as everything else, and I wanted to mention it first. Now, let's talk about some of the physical treatments that can be done. For managing the pain in the legs that can come from this excess fat, I mean, yes, there are medications and things like that. You might need a pain specialist, but sometimes things like wearing compression garments can actually help, okay? Compression garments are basically special stockings or like leggings that you can put on. It gives sort of steady pressure throughout the leg. We often use these when people have edema and other conditions as well, but it might help in the situation of lipedema, and your doctor certainly can talk to you more about that. Now, managing weight is going to be super important, but I'm not going to act like, oh, just go ahead and manage your weight. It's super simple, like just go do it, because that seems really dismissive. And honestly, managing weight is one of the hardest things people ever have to do, okay? It's important to get regular physical activity and eat healthy, but let me just talk about getting regular physical activity when you're in pain. How easy is that going to be? It's probably not going to be that easy. So again, I don't want to be dismissive and be like, oh, just exercise more, just eat healthier. When there's emotional stress, when there's pain, when there's excess fat sort of abnormally distributed in your body, it can be really, really hard to increase physical activity and do those things. Trying to work on your diet is something that can be very helpful. Working with a nutritionist. Some doctors actually recommend weight loss surgery, and so that may be something that you and your doctor talk about. There's also procedures such as liposuction, which is a procedure to remove extra fat, whether it's from your legs or what have you. Again, whether this is a good option for you is something that you and your doctor will need to discuss, and you'll be able to decide together. I think one of the most important things is to understand that if you have lipedema, please understand that we see you and we hear you. And also know that we get that not everyone understands this condition. Not every doctor understands it and knows about it. And I really feel like as a family doctor, it's even something I've been hearing more about in the last few years and didn't hear about much before that. So if you're feeling frustrated, sometimes I liken this condition to something like fibromyalgia or some other conditions. It's not the same by any means, but sometimes it can feel difficult to get help. I would definitely start with your family doctor, but you may need additional specialists on board to help you with your journey. As I mentioned before, remember that people with lipedema can also have lymphedema, so that may be something that confounds your treatment and your symptoms as well. Be persistent, take care of your mental health. Know that there is hope. And I always say this, if your doctor is not listening to you, is not really sort of hearing you, find another doctor who will and who does, because you really deserve that. Again, if you haven't written in the comments, please do. I want to hear your stories. I want to hear your situations. Check out some of my linked videos that I've put throughout here. Also on YouTube, I will list the videos in the description of this video. Guys, I'm Dr. Jen Caudle. I hope this is helpful. I do daily videos. Please subscribe to me on YouTube. Please follow me on Facebook. I'm on Instagram, TikTok, LinkedIn, WhatsApp, Threads, you name it. Please follow me everywhere. And sign up for my free health newsletter at drjencaudle.com.